So today I will talk to you about my final role, which I decided to choose in my field, which is psychology, and the subject is behaviorism. So I will firstly talk to you about the most common interventions, which are the principal methods used with therapists these days. So the first one is the exposure for anxiety. The second one is the assertiveness skills training for most social and interpersonal difficulties. And the third one is the behavioral activation for depression. I will now talk to you more about the first one, which is the exposure for anxiety. So its objective is to approach, is to face, to confront anxiety triggers rather than avoiding them or escaping from them. So what the therapist will do is will talk to their patient about their problems, and they will face them and confront them, and not only just let them go. The second one is the assertiveness skills for training. Its masters of assertiveness use the verbal intensity necessary to protect and to defend against an aggressive or hostile person. This can be seen as karate, as to defend yourself against people or just for yourself. And the third one is the behavioral activation for depression. It is the one that I chose. I chose it because it's the most common, and to me it is the most effective. So as I said, it's the most effective non-medical intervention for most depressive disorders. It encourages depressed clients to engage in more general activity, physical movement, and social interaction. When someone is has depression, there's a lot of there's less motivation to do anything, so their therapist will encourage them to do social interactions as like activities and physical movements. A little bit more about the history. Pavlov is one of the first behaviorists. He published in 1897 the results of an experiment on conditioning, which is about a dog and the bell. I will talk later about the types of conditioning if you don't know what I mean. Also, in 1913, John Watson, which is the guy in the picture, he wrote an article entitled "Psychology as the Behaviorist Views It." These two that I just showed are the first behaviorists to publish things or to mention this method, and I just wanted to say that this method has strongly improved over the years. It has developed, and it is not the same as it was 200 years ago. So Watson described the purpose of psychology as to predict, given the stimulus, what reaction will take place, or given the reaction state, what the situation or stimulus is that has caused the reaction. Although this method is mainly used on humans, it is also used on animals. But historically, the behaviorists preferred not to study the existence of cognitions and emotions, but to study mainly things that could be objective and scientific. So that means that nothing in your brain or mind was mainly observed, or the environment was the only thing that was observed. The different behaviorists did scientific experiences, such as the little Albert. But these days, therapists use a more developed method and are closer to their patients than they used to be 200 years ago. 200 years ago, the human was mainly an experiment, And now it is truly a patient, and the therapists only want to help their patients on a long and short term. The strengths of this method, there's a few. The first one is the fact that it can explain scientifically with the support of evidence. There's real life applications like therapy. It emphasizes objective measurement, and there's many experiences to support theories that have been used over the past few years. Although there's a lot of strengths with this method, there's also limitations. The fact that it ignores medicinal processes is a big limitation. Like I said before, there's types of conditioning. There's actually two, and I'm gonna explain the first one, which is the classical conditioning. So the classical conditioning is a technique used in behavioral training in which a neutral stimulus is paired with a naturally occurring stimulus. And eventually, the neutral stimulus comes to evoke the same response as the naturally occurring stimulus, even without the naturally occurring stimulus presenting itself. This way, it can sound pretty tough, but it's actually pretty easy, and it's the same. It's actually the explanation of the dog's experiment by Pavlov with the bell and the dog. The second type of conditioning is the operant conditioning. It's through operant conditioning, it's an association that is made between a behavior and a consequence for that behavior. When a desirable result follows an action, the behavior becomes more likely to occur again in the future. So this one may seem more common to you. You actually use it almost every day. When something good happens, it becomes more likely to occur again in the future by your behavior. The main things to know about the behavioral psychology, the first one is that it can occur through associations, like with the environmental stimulus and the naturally stimulus. Secondly, there's different factors that can influence the classical conditioning process when a response is established and strengthened. Number three, learning can also occur through rewards and punishments, like I said before. And number four, there's reinforcement schedules that are important in operant conditioning. So in conclusion, there's strengths and limitations, although it is the method that is most commonly used. It also have limitations like everything else, although the strengths are there's fewer strengths. So there's different types of conditioning, like I said before. There's two. There's the classical conditioning with the dog and the bell, and there's the operant conditioning that is more likely to happen to you on an everyday basis. And also, I wanted to say that the method has strongly improved over the years. So when it started with Pavlov, it was only used on animals, and when it was used on humans, it was more as an experiment than an actual therapy as in today. So today the therapists use this method to help their patients in a healthy way on a daily basis to get results for their patients on a long and short term.